This is Dr. Dennis Locks. Today we're going to talk about bilateral hip AVN. Hip avascular necrosis is the most commonly joint affected with avascular necrosis. Avascular necrosis is where blood supply is lost to the joint, resulting in bone cell death. And again, the hip is the most commonly affected joint, and it can be seen quite often in both hips. The most common presentation of hip AVN is due to trauma. Trauma usually occurs in just one hip, but bilateral hip AVN is usually associated with other disease states. The second most common cause of avascular necrosis to all joints, including the hip, is idiopathic or insidious onset of unknown origin, and this can be seen in both hips. The other more common things that we see are high-dose corticosteroid use, from intravenous use for steroid-dependent asthma, emphysema, COPD. We see this a lot, and some of the rheumatologic conditions such as rheumatoid arthritis or lupus. They can often have loss of blood supply to bone infarction to both hips. It's also called bone infarction or osteonecrosis. Osteo, bone, necrosis, cell death. Same thing. We see that in radiation therapy, chemotherapy. It can affect both hips, but can also affect a hip or a knee, or on the other side, and I've seen it in patients that can have diffuse patterns with these systemic problems, that it'll be a hip, a knee, and an ankle. I've seen all kinds of presentations. It's also found in the shoulder, wrist, other areas from traumatic injuries, ankle. But when we're talking bilateral hip, the hip is the most commonly affected joint. And when you think pain in one hip and it's diagnosed AVN, if the patient down the road starts complaining of other hip, you have to think possibility of AVN. So an experienced doctor who's treated AVN, I have patients from around the world who come see me for avascular necrosis. The experienced physician is aware of that possibility. And then we can utilize our treatment regimen to address both hips. We're utilizing regenerative medicine and stem cell therapy for this with good results. Again, getting a patient early, diagnosing them appropriately helps with this. Thank you.